Let's come over to the wall. Begin with your dominant leg closest to the wall. You're going to step it back, far back in a lunge position, keeping a soft bend in both knees. Legs are parallel and hip distance apart. Let's take the same arm as the back leg up into a V with the outer edge of the thumb and arm on the wall, soft micro bend in the elbow. You're going to be twisting your torso away from this arm, keeping the knees both tracking forward, softly bent with the back knee, deeply bent with the front knee. Press the pelvis forward, brace the abdominals. We're opening up your posturally tight gastrocnemius, that's your outer calf, as well as the anterior delts and biceps, the front of the shoulders and the biceps. As you're breathing, keep your focus up eye level, apple distance between the chin and the chest. Hear those exhales taking you deeper into the twist for the upper body stretch. Keep pressing the pelvis forward and driving that back heel down to stretch that gastrocnemius out. Let's take your next exhale to move to the other side, setting up. Make sure the leg that's back is the closest to the wall, counter, or bar. The arm that's up is the same as the back leg. There's a soft bend in the elbow of the arm that's lifted, and you've rolled to the inner edge. I think I said outer edge, but it's the inner edge of your thumb so that the arm internally rotates a little in the socket. Soft bend in the knee of your back leg, driving that heel down, pressing the pelvis forward. Keep a deep bend in that front knee and let that knee track forward over the second and third metatarsals. Hear your exhales. Inhale, prepare, brace the abs, lift those lower abdominals in and up to twist, keeping your head on your spine and apple distance between the chin and the chest. From here, we're going to learn the 3 exercises we'll be doing for our cardio burst on the trampoline. For now, what I'd like you to do is grab your anti-burst ball. You're going to bring that between your inner thighs once you're up on the trampoline. Arms are going to come into a serratus anterior position, 2 right angles, and we're isometrically going to hold them. Let's begin by doing 4 bounces, keeping the knees soft. And as you work, just keeping a micro bend in the knees, you'll do 4 bounces. And then I'd like you to shift to your dominant leg. The other leg is going to kick towards your butt. Brace those abs, maintaining a neutral pelvis. After you've done 4 bounces on your dominant leg, you're going to do a quarter turn, 4 more bounces on that dominant leg, and then 4 to come back to center. So it's 12 total, and then you're back to 2 legs for 4. And then you go back to your non-dominant leg now for 4, 3, 2, 1, turning 4. So it's a quarter turn, so make sure whatever leg you're jumping on, you're turning in that direction. And then it's going to be a little different as you turn back on that same leg. So you're breathing, make sure you're breathing, and the knees are staying soft. So this is our exercise in the transverse plane. We'll revisit this at 100% effort in a bit. Our next exercise, we're going to need our heaviest Theraband. We're going to keep this ball between the inner thighs. So bringing the band behind the shoulder blades, wrapping it from the ends around the hands, around the knuckles with the thumbs on the outsides, palms facing up, soft bend in the elbows. It's here to remind you to use your upper back. Chest is reaching for the shoulder blades, closing the front body, so we don't over-recruit the anterior delts that we just stretched in the pec major and pec minor. Instead, our upper back extensors to combat kyphosis. 4 bounces with the knees soft. Then the dominant leg is going to bounce forward and back for 4, 3, 2, 1. Back to 2 legs, 4, 3, 2, 1. Now the non-dominant leg, 4, 3, 2, 1. Back to 2, 4, 3. So we're just keeping the arms extended, isometrically held, chest reaching for that band behind our back. Focus up eye level. Make sure the leg that's lifted, the heel's kicking towards the butt. You can feel the opposition of the knee, the foot that's down, that knee tracking forward. As the leg that's lifted, that knee tracks back, but really squeeze. Use those adductors to squeeze in on the ball. We can set that band to the side, and we're now going to learn our final exercise in the frontal plane. Arms are going to be in a T position. Soft bend in the elbows. Make sure the wrists are slightly below the shoulders, and both arms are in your peripheral vision, so they shouldn't be behind your back or behind your shoulders. From here, 4 bounces, soft bend in the knees, and then with your dominant leg, we're going to go side to side. Keep it small. 4, 3, and if you have sway back posture, I want to emphasize the pressure in the bone of your big toe. You can ignore this cue if you have flat back posture, but if you're sway back posture, we've got to start combating the supination that's happening in your feet. And with flat back posture, sometimes we do see a bit of supination, but more than anything, we see that deep plantar flexion in the ankles. So as you're working here, make sure you're bracing your abs, you're squeezing that ball. So it's 4 center, 4 with our dominant leg side to side, 4 center, 4 with our non-dominant leg side to side. Great. Now that we know the exercises, we're going to bring our arms into that serratus anterior hold, those 2 right angles, keeping the wrist flat, elbows as high as the shoulders, head on the spine. We're going to work in the transverse plane. We'll be doing our cardio burst, reminding you that that's 4 center, 4 on your dominant leg, 4 turning on your dominant leg, 4 back on the dominant leg, and then 4 again center. And then we repeat on the non-dominant side. I'm going to count you in. Brace those abdominals. Keep your focus up eye level. Watch out for droopy elbows. Keep those right angles. Counting you in 3, 2, 1. 100% effort. I want to see all you got here. Working in the transverse plane, engaging our adductors, our hip flexors, working our upper back extensors to combat kyphosis. This is an excellent way to exercise and improve your endurance. It's also a lot of fun. As you're working, hear your breath. You're doing great work. Watch out for locking in the knees. Keep those knees soft. When you're doing your turns, take those 4 jumps to get around. If you can do it in 1 jump and it feels safe and easy, do so. Counting you down 3, 2, 1. Take your minute recovery. If you need to take a stretch, take a stretch. If you just want to stand still, let that heart rate lower so that we can spike it back up, do that. Wherever you are, focus on your breath, try to relax your mind. Jumping is an excellent way to work your lymphatic system. It's highly recommended for people who suffer from cancer. So if you have any friends or family that are undergoing treatments for cancer, suggesting a trampoline program for them would be really, really wonderful. Okay, I'm going to count you in. Second set here. 5, 4, 3, 2, 1. Let's begin. So make sure that after you've done the 4 center, you start with your dominant leg to reinforce the muscle memory and pattern so that when we go to the non-dominant side, it knows what to do. It's highly recommended that when you do unilateral work, that single leg or single arm work, you begin with your dominant side. It doesn't mean you have to do as many repetitions. For instance, if you have scoliosis, sometimes it's better to start with your dominant side so you understand the exercise and then double the repetitions on the non-dominant side. So we'll play around with things like that, but for now we're keeping it even just for the sake of counting so that you can really enjoy this endurance work and reap the benefits cardiovascularly. As you're breathing, watch out for holding the breath. Watch out for looking down. Apple distance between the chin and the chest. Remember, it's 4, and then 4 to turn, and 4 to turn back. I like to do 4 in place on that single leg just to prepare myself. Counting you down. 5, 4, 3, 2, 1. Take your break. We got 1 minute here. I'm going to remind you of the next exercise. You do not need to do it. I want you to take your recovery. Take the heaviest band behind your back, gathering it from the ends, reminding your chest to reach for the back of the shoulder blades, closing the rib cage. Soft bend in the elbows, palms facing up. So we're now working in the sagittal plane, doing 4 bounces, and then we start with our dominant leg forward and back for 4, 3, 2, 1, back 2, double legs for 4, and then that single leg forward and back on the non-dominant side for 4, 3, 2, 1. So that's it. Keep the range of motion small till your body gets used to it. Remember, if you have sway back posture, to really press into the bones of your big toes to combat the supination that's prevalent in your skeletal structure. Keep the inner thighs engaged by squeezing in on that ball. Okay, I'm going to count you in. 5, 4, 3, 2, 1. Give me 100% effort. First set in the sagittal plane here on the trampoline. Trampoline is an excellent way to condition the heart and to find that inner child within you. I always am transported back in time when I'm jumping on the trampoline to my early years of adventure and being a free spirit and just relaxing and being more in the moment. These are all things that as adults, teenagers, we need to be reminded of the importance of these. So as you're breathing here and enjoying this, try to let go of frustration and being perfect. Just focus on the quality of the movement and enjoying yourself. You have 15 seconds as you're going forward and back. Notice where the weight is in the feet. Keep the knees soft, tracking over the second and third metatarsals, counting you down. 5, 4, 3, 2, 1. Take that break. We're going to repeat this exercise one more time in the sagittal plane. If you want to take the band off, you do have a full minute recovery, so I'll give you 15 seconds notice before you need to get that band ready. Just make sure you're not sitting down. If you need to take a stretch because the muscle's feeling tight or a little weird, do that. But don't sit down. Let's let that heart rate drop, but we're going to spike it back up. Cardio bursting, according to the National Heart Association, is just as effective as doing cardio for long periods of time, and it saves you time. So why overdo it when you don't have to, when you're going to get the same benefits, both calorie burning and with your heart health? You have 15 seconds before we're going to begin, so make sure you're getting that band ready. You're reminding yourself the reason we have this band here is to close our rib cage, to bring our chest back towards those shoulder blades. Counting you in. 3, 2, 1. Second set in the sagittal plane, going forward and back on a single leg. Center, we're doing 4 bounces on both legs. Always start with that dominant leg to get your body used to the movement so that non-dominant leg really knows what it's doing. Remember, if you're sway back, bones of the big toes heavy. Use the inner edge of the foot to combat that supination. Where is your gaze? Make sure it's soft and it's up, eye level. Roll those shoulders down the back. Watch out. They're going to want to round forward. Do not let them. Let's fight that. Keep the back of the neck long, head on the spine. Hear your exhales. And when you're on one leg, just focus on keeping the abs engaged and your pelvis tipped back a little. We don't want to round that low back. Let's fight that tendency to work in pelvic flexion with a neutral pelvis. Imagine that ball behind your low back. If you've done any of the strength series, you're used to it being under your sacrum and what that feels like to have extension. Counting you down. 3, 2, 1. Take your break. I'm going to show you the final exercise. We have the arms in a T, and the ball's still here between those inner thighs. And what we're doing here is we're doing side to side movement now. So 4 on 2 legs, and then with our dominant leg side to side for 4, 4 on 2 legs, and then non-dominant leg side to side for 4. So same idea. We're getting those adductors, those hip flexors, the upper back extensors really strong. Just don't drop your chin to the chest. We don't want that neck to start bothering us. We want to keep the focus up, eye level. I speak from experience because I do a lot of different types of exercise, and I know that form is imperative to stay out of pain. Let's set up. I'm counting you in for 5, 4, 3, 2, 1. 100% effort. First burst in the frontal plane here. I want to see good form, so check in with those checkpoints. If you have sway back posture, the bones of the big toes are heavy. Squeeze those inner thighs in on the ball. That's going to really help you not feel knee discomfort as you go side to side. And remember, it's not about how far you go side to side. It's about the quality of the movement. If you feel knee discomfort, you're not using your whole foot. You're not balancing the feet and ankles. And this type of work we're doing will help with that. It will help you rebalance your feet and ankles. And this will help prevent injuries, and also keep your back safe and condition your core, which will help you move through space with a new, longer, stronger look, improving that posture. Counting you down. 5, 4, 3, 2, 1. Great. Okay, let's take our final break before our final burst. You're doing excellent work. I want you to take that full minute, stretch anything that is feeling like it needs to be stretched. I'll give you ample time. I'll give you 15 seconds to set up, to breathe, to prepare yourself mentally for this final burst. You've done great work today. Continue to show up, and remember, you can really help somebody out. If you know anybody that is undergoing cancer treatments for any type of cancer, trampoline work is the best cardiovascular work for their lymphatic system. Please refer them to YouniquelyFit so that we can help. All right, setting up, you've got 15 seconds. Let's think about what we're doing, using our abdominals. Okay, counting you in. 5, 4, 3, 2, 1. This is it. Final burst in our frontal plane, moving side to side, double legs for 4, dominant leg for 4, double legs for 4, non-dominant leg for 4. Don't let those arms move all around. Keep them long and strong, little micro bend in the elbows so you don't lock out in the joints, head up on the spine, apple distance between the chin and the chest, neutral pelvis. What does that mean? It means you're not arching it and you're not tucking it under like a scared puppy. Abs are pulling in towards the spine. If your shoulders are rounded forward, just roll them back, keeping those arms still long with the micro bend in the elbows. Head is up on the spine. Facial muscles are soft. You're breathing. You're breathing into that rib cage. You're pulling your abs in and up like you're putting on a tight pair of jeans. You're lifting up internally on the muscles that stop your stream of pee to contract the deepest layer of your core, the transverse abdominis. Counting you down. 5, 4, 3, 2, 1. Great job. Grabbing a sip of water, taking any stretch that feels necessary after that cardio burst work. So every time you work with us on your endurance, remember, cardio bursting is the most time-efficient way to condition the heart, but you should be pushing yourself to the limit. As hard as you can go with the awareness of your checkpoints. Your abs are always being braced. You're always thinking about what's happening in your feet, your knee traction, your rib cage, your neck alignment, retracting your chin so the back of the neck is long and the front neck muscles are working. We're going to move into some flexibility now. Setting up for a wall calf stretch, facing the wall, feet are hip distance apart, stepping one leg back for a calf stretch, opening up the gastrocnemius here, driving the heel down as the pelvis drives forward, tailbone reaching away, little lumbar extension. Without pushing the rib cage forward, close those front ribs, plug the shoulders down the back, retract your chin, back of the neck is long, eyes should be focused eye level. And think about your breath. Inhale, pull the abs in, lift up on the muscles that stop your stream of pee, hold that lift, driving the heel down and the pelvis forward at the same time. Again, inhale laterally into the rib cage. Pull the belly button in. Lift up on those muscles that stop your stream of pee. Hold it. Sustain it. Drive the heel down and the pelvis forward. Keep going with that breathing. Back of neck is long. Collarbone is wide. That front knee shouldn't be tracking beyond the metatarsals. Go ahead and step that back leg forward. Start with the legs hip distance apart, stepping the opposite leg back. Look over your shoulder. Is the leg perfectly parallel? That includes the foot. Drive the pelvis forward as you drive the back heel down. On your exhales, inhale through the nose, pull the abs in, brace the stomach as if you're going to be punched in the gut, drive the pelvis forward and the hips and the heel down, exhaling the air out the mouth. Be cognizant of your breath. Your eye focus is also important here so we don't encourage that forward head syndrome. So retract your chin, give me a double chin so the back of the neck is long. Watch out for the shoulders elevating. Keep them plugged down. Sternum reaching towards the back ribs, closing, allowing access to the lower abdominals and the upper back. A few more seconds here. We'll move into a quad release on one side, kicking one heel towards your butt, grabbing the outer ankle, dorsiflexing the foot, soft bend in your supporting knee, bone of the big toe of your supporting leg heavy in the floor. Inhale, exhale to drive that thigh back, bracing the abdominals. Inhale, abs in, contract. Exhale, drive the thigh back. 2 more breaths. Inhale, contract. Exhale. And inhale, release the leg, turning and setting up on the other side. We're working on opening up the quadriceps after our cardio burst. All that hard work. Breathe in, make sure your supporting knee is bent softly. The bone of the big toe of the supporting leg is heavy. And you're really driving that thigh back on your exhale. We'll move to the floor for a prone floor twist, setting up a right angle, turning our head away from that right angle. That elbow of the right angle should be in line with the shoulder. Other hand by the chest. Keep the head down as you spiral and lift the same leg as the hand by the chest up and back. The knee is bent. The big toe is on the ground. Dorsiflex the foot to keep the knee safe here. You're getting an opening in the pec minor as well as your hip flexors. Use your exhale as a chance to deepen the twist. Inhale, prepare. Exhale, twist deeper. Inhale, prepare. And here is a great chance to work on those ribs not spraying forward. Even though we're in extension, we want to find our back. We want to bring the sternum in towards the back ribs so that our upper back can fire here and we can pull our abs in to support the low back. Inhale, brace your abs and spiral out of the twist, making your way to the other side, setting up, creating a right angle, elbow tracks right in line with the shoulder, hand by the chest, head is turned towards the hand by the chest, same leg as hand by the chest lifts up, spiraling around, dorsiflex the foot, heel can rest on the ground, but watch that the knee doesn't start to collapse down. Keep lifting up from the top of the groin. The hip flexor will stretch here. Inhale, brace the abs. Sternum reaching towards the back ribs. Exhale, twist deeper. Keeping the head down, the temples should be resting on the floor. Retract your chin to keep the back of the neck long. And make sure you're breathing. Inhale, abs in. Lift in and up on the muscles that stop your stream of pee. Fog a mirror as you twist deeper into this nice prone floor pec and psoas opener. From here, we'll move into foam rolling for your IT band. You'll be in a side plank position. Don't collapse into that shoulder of the forearm that's down. Use it as a chance to also condition the lats. We'll walk forward and back, rolling out the fascia on the outside of the thigh laterally. Breathing. You can put that top foot down either behind or in front if that's helpful, or if keeping it lifted in the air and stacking the legs feels better, this is also an option. Just make sure you're not collapsing into the forearm, into the shoulder of the arm that's down. Other hand can be behind the head to support it, on the hip, on the roller, wherever it feels like it's out of the way and you can focus on the fascia release of your IT band. Go ahead and switch sides, setting up. And if at any time you have one side that's significantly tighter than the other, feel free to go back. Most of the stretches we're doing now, unless they're a release, are postural, so we're holding for a full minute. So you can stay for a minute 20 or a minute 40 on your dominant side and do a quick release on the non-dominant if it doesn't feel tight. Make sure as you're rolling here, you're not spraying the ribcage forward. We want to always be engaging our abs and our upper back as we work. This will bring us into that optimal alignment and perfect our posture. combat the kyphosis, and help alleviate chronic back pain. 15 more seconds here, finding fascia in the IT band, that overactive lateral chain, the hamstrings, even getting up into the glutes as you roll up top. From here, we're going to come into a rectus opener, rectus abdominis opener, getting into the upper fibers of the internal obliques in the rectus abdominis. Hands behind the head, place the roller behind your shoulder blades, feet on the ground, tailbone reaching towards the feet for some lumbar extension, and we'll allow gravity to do the work as we extend our chest, elbows pointing out to the side, chin retracted. Press your shoulder blades into the roller. This will intensify the opening and the upper fibers of the abdominals where you're overactive. Breathe here. Be cognizant of spraying the ribs forward. Go ahead and push those back ribs and shoulder blades into the roller, intensifying the stretch. Inhale, abs brace. Exhale, press the back ribs, heavy, heavy, heavy. Chin retracted. Inhale, last breath, brace the abs. Exhale, press, 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 deepening and lifting up. We'll grab our ball to lie supine, placing it under our head for a figure 4 stretch, crossing our right ankle over our left and threading the hands through to bring the left hamstring towards the body. Opening that right thigh with the right elbow, dorsiflex the crossed leg foot so that you keep the knee tracking safely. Reach the tailbone towards the bottom of the mat in an effort to keep lumbar extension. And check in with your breath. Breathing in and exhaling. Deep inhale. Brace the abs, pulling that hamstring closer towards you as you open the opposite thigh, using the elbow as leverage. Go ahead and switch sides, setting up for your supine figure 4 stretch. You can also use this as a chance to stretch the back of the neck, giving me a double chin, retracting that chin, engaging your neck flexors to release the neck extensors. Make sure the foot that's crossed is dorsiflexed. The tailbone is down and reaching down towards the bottom of the mat, allowing you to access the upper fibers of the glutes as you pull. The glute med, the piriformis is opening. If you round your low back, you don't get the full attachment stretching. So make sure to try to keep the pelvis neutral and try and accentuate and reach the tailbone down and away from you for a subtle bit of lumbar extension. Just a bit longer here. 5, 4, 3, 2, 1. Our final stretch, we'll grab our heaviest Theraband. You can keep the ball under your head, hooking the band around the arch of the foot, sliding the other leg out long. We'll internally rotate the leg in the hip socket, taking it across the body for a deep IT band stretch. Reaching the tailbone towards the bottom of the mat, dorsiflex that foot, squeeze the front of the quadricep, lift the kneecap. You'll feel the peroneals, the outer calf, the outer hamstring, all the way up to the hip stretching. Do your best to take the rounding out of the lumbar. Imprint those back ribs into the floor at all times. Really activate them so we can turn off the pecs, the anterior delts, and recruit the upper back. Stay aware of your pelvic position, tailbone reaching away, collarbone wide, shoulders plugged down the back. Breathe in, pull the abs in towards the spine, lift up on the muscles that stop your stream of pee. Hold that lift. Bring the leg a little farther across. Go ahead and switch sides, bracing your abs. Setting up. Internal rotation of the leg from the top of the hip socket, crossing the body. Dorsiflex the foot evenly from the outer and inner edge. Reach the back ribs into the floor, pressing them heavy, shoulder blades heavy into the floor. Chin can retract, lengthening the back of the neck, engaging your neck flexors. Tailbone reaches towards the bottom of the mat. Inhale. Brace your abs as if you're going to be punched in the gut. Deepen the stretch, dorsiflexing, squeezing the front of the quadricep and moving the legs subtly a little farther into the stretch. Inhale, brace, moving deeper into the stretch. Inhale, abs in, contract them, hold the contraction, and exhale, deepening the stretch. Moving out of it with awareness, keeping the abs braced. Good job.